Surgical management. So I think you've done this, and I think you've already sort of highlighted, but it's where rehab fails. At what stage do you sort of say, you know what, we've had enough of rehab?
Usually the patients know when they had enough, to be honest with you, Rus. When they have had their injections, they have had their physiotherapy, when they have not improved, they say, look, do something for it. So then offer them, the operative treatment. And the operative treatment, again, it's a day case procedure. You will come in the morning. The procedure itself doesn't take myself more than 15 minutes, 20 minutes. It can be done under local anesthesia or general anesthesia, whatever the patient prefers. In 2 weeks, you take the sutures out. And honestly, at 2 weeks, I see the patients improving already. They're already happy with the outcome. And by 6 weeks, everything is fully healed with your help, obviously, Russ, in the rehabilitation, and they're back to their normal activities. With regards to golfers and tennis elbow release, I cannot, not based on my studies, on my facts. My facts, I might say whatever I want, but based on the good clinical studies, they have up to 90% success rate, when you know how to properly release a
Yeah.
tennis or a golfer's elbow with proper physiotherapy, obviously.
Yeah, and just again, guys, if you're getting golfer's elbow, you're getting tennis elbow, and you're getting lots of pins and needles, like please, please, please don't leave it to last minute. The more irritable a nerve is, the more time it's going to take for that nerve to settle down. And one of the things we know that is that if people don't get that help on time, it can really affect it. So just a bit of a brief anatomy. So I'm always a big fan. I'm a bit of a geek. So this is your sort of bony prominence in the inside part of your elbow, and then you can see how close these nerves sort of run around it. Now, there's a reason why you will feel a bit of pain around there and tingling because of that pressure that can go on these nerves. So, Dimitri, you want to talk through this patient of yours?
Yes. So this is one of my patients that has been recently discharged from my care. He had an injury back in February 2020, unfortunately, just before the COVID pandemic, stepped in. He had telephone consultations with his GP, then followed up by injections, I'm afraid, both on the medial and lateral epicondyle, was not improving his symptoms. Eventually, he ended up in my clinic somewhere around November with severe both medial and epicondyle and lateral epicondyle pain, with symptoms from his ulnar nerve, with reduced sensation over the inner aspect of his hand, with finger escape sign, as we call it, where he could not close his little finger inside, or where his the little and the ring finger were sitting like this. So, it has the characteristic clinical sense. We proceeded with urgent nerve contraction studies. It showed, on top of everything, compression of the ulnar nerve. We decided to go on and release both the medial and the lateral side with very, very good outcome. This video is now 6 weeks after the operation, and he's already discharged with proper, with full range of movement around his elbow, pain-free.
Yeah. And again, it's important to know that although he's elbow pain free, he still needs to take his while to build strength up over the period of time. So